Good morning, everyone in the hall. I'll be starting on the existing protocol, and my warm heart congratulations to Professor Ibila on his 60th birthday. As introduced, I'm Dr. Kunle Adesina, and I will be taking us through substance abuse and how it affects you. Yeah. Okay. I have it on PowerPoint, so media, please, I would like you to project. For the youth in the house, rise up. What do we say? If I say rise up, you say? Rise up. Rise up. All right, so I will be taking us through substance abuse and its effects on you. What is substance abuse? Of course, substance abuse is defined as the harmful use of any psychoactive substance. Who can tell me what the meaning of psychoactive substance? Any student in the house? There are a lot of gifts today, so I want you guys to participate. What do you understand by psychoactive substance? Can anybody talk? Psychoactive substance. Have you heard of it before? Okay, let me take the lead. So a psychoactive substance is a chemical that is potent enough to alter the chemistry, the hemostasis in the body. And we have lots of psychoactive substances in our environment. Who are the people at risk? You can see anyone is at risk, but teenagers are especially more vulnerable because of the brain development. We know, I'll still share more light in the subsequent presentation as to how the brain continues to develop from teenage even up to the age of 25. And because the brain is one of the last organs to be fully developed in the body, then making good decisions during teenage ages or teenage years becomes very difficult. Substance abuse can permanently change your brain, harm your body, and of course derail the future. Next slide. 1 in 5 teens have tried one illicit substance or the other by the age of 15. In fact, according to the last UNODC report, we have about 14.3 million Nigerians that have tried one psychoactive substance or the other in the last 6 months. Of course, drug overdose is the third cause of teenage death in our environment. 90% of drug abuse begins during teenage years. Also, that can also be explained because of the development of the brain, which we'll still share more light to as we go on. About 40% of teenagers who drink alcohol do so before the age of 15. What are the commonly abused substances in our environment? Of course, cannabis topped the list. We saw in the BBC documentary when cannabis is referred to as Kush, or referred to as K2, or referred to as Colorado. K2 is Colorado, of course it's also Kush in some African country, but in Nigeria we call it Colorado. That's the synthetic form of cannabis. We know that cannabis contains THCs, that's tetrahydrocannabinoid in it, and then the synthetic form of it is the K2, and that increased the surge of substance abuse in our environment. Of course, pharmaceutical opiates in cough syrups like codeine, tramadol, morphine, pentazocine, fentanyl, and other pharmaceutical products are also abused. Going down to alcohol and then to hard drugs or harder drugs now. Because even alcohol and cigarettes are hard drugs, but let's put it as harder drugs like cocaine, heroin, methamphetamine. Who knows meth? What's the street name for meth? Yeah, what's the street name for meth? Okay, good. Ice. Ice is the street name for meth. In the East, they call it Umpurumiri. Yeah, good. Okay, put your hands together for yourselves. You are making my work easier. So, because the funniest thing is that in fact, most of the parents that we have now, they are not as informed as their 12-year-old son or daughters. At 12 now, most people know not only the psychoactive substances, but they know the street names of these psychoactive substances. So you hear street names like Rochi, like Rohypnol, Blue Boy, and all of them on the street. And then parents will wonder, who is the blue boy around? We understand. Okay, let's go to the next slide now. Reasons why people do drugs. We've seen that about 87% of people venture into drug use because of peer pressure. You can see how the young man, the Danladi man in the drama, was pressured to the point of tasting his alcohol for the first time. And peer pressure is a big etiological factor in the causation of substance abuse. Of course, socioeconomic status is another one. People from extremities of families, super rich and super poor families, you are more predisposed to having substance abuse problems. Of course, up to family dynamics, children that are born to parents that are users are 10 times more likely to abuse one substance or the other in their lifetime. We would also see from the lady's analogy in the drama that, oh, my so person's grandmother gave her alcohol even while she was a baby. That is the direct effect now. So you see kids that are born to families where we have substance abusers, they are 10 times more likely to end up being drug addicts in their lifetime. The next slide, why the teens are more vulnerable. The teenagers are more vulnerable because the brain continues to develop until the age of 25. In fact, it's 24 to 26. Our brain is one of the last parts of our organs that gets developed. And the lateral sulci of the prefrontal cortex is the last part of the brain that develops again. And this is the part of the brain that we use to make decisions. That is the emotion center. That is the part of the brain that gives good judgment. And this is also the first part of the brain that substance abuse affects. Do we understand? So, a teenage brain that is still growing, if you're 17, 18, 19, 20 in this all, your brain is still growing. Introducing a psychoactive substance into the architecture of the brain while the brain is growing means that the brain gets rewired and the brain gets used to that chemical until the brain is fully developed at the age of 26 or 25. And that means that even when this person's addiction is fully formed, overcoming that addiction becomes a lifetime struggle. Do we understand? So teenagers are 2 to 4 times more likely to be addicted than adults. So an adult starting to use a substance at the age of 30 and someone that started earlier in his teenage years, the teenager is 4 times more likely to be addicted to that substance than the adult, because the brain now the brain grows and the brain fuses and the whole brain becomes developed with the substance in it, and then recovery becomes more difficult. How addiction works. Of course, you will see from the drama too that addiction starts from curiosity, experimental use. Oh, let me try this substance. Oh, my friend is doing it, why not let me just use? And the person leaves. What the brain feels is the dopamine rush, because the dopamine rush, the dopamine pathway in the brain is the reward system in the brain. And then the brain feels that intense feeling of pleasure. If I'm an 100 level student and I've taken Kush and I feel like the Vice Chancellor of Federal University, Lokaja, you know, that feeling is good, that feeling is real. Then I will not have the need to study again. To graduate from as an undergraduate, not to talk of doing my master's, not to talk of doing my PhD or writing my papers. Because already I am living as a vice chancellor in 100 level in my brain. And that is the dopamine rush to the brain. And then of course, the third point, the brain develops tolerance. Tolerance is that the small dose that excited you the first time is no longer enough. And then the brain calls for more. Okay, this person used to do 2 milligrams of heroin. Now the 2 milligrams of heroin is no longer enough. to stimulate the brain. Then it needs 6 milligram, then 10 milligram, then 20 milligram, then 90 milligram, till life becomes unmanageable. Of course, that leads to the fourth point, and that is dependence. To the fifth point, that is addiction. And by the time addiction is made as a diagnosis, we say addiction is a chronic relapsing disorder of the brain that is characterized by compulsive use of a psychoactive substance, despite obvious, grievous, negative consequences. So at the point of addiction, the brain enters a chronic pathway and the nature of chronic illnesses, not just in the brain now, all over the body, like hypertension, diabetes, the nature of chronic illnesses is that they have the ability to wax and to wane. When you are actively managing your blood sugar, for instance, it wanes as though you are not diabetic again. When you're tired of managing it, it waxes stronger, and that is the relapse. And that is why you see people, even at this point of addiction now, they now enter into recovery, but they keep moving in and out of recovery. As they are trying to do well, they relapse again, they go again, relapse, and that's a chronic pathway. And then, of course, withdrawal, stopping causes painful psychological and mental symptoms. We call it psychological dependence and physical dependence. Next slide. Medical consequences of substance abuse. You can see in the cardiovascular system, every organ system is affected, from the veins to the arteries to the heart. In fact, by the time you see a young person coming down with cardiovascular issues before the age of 40, the first question is, do you abuse any psychoactive substance? And more often than not, they abuse one substance or the other. The next slide. In the lungs, you can see the healthy lung on the right and the infected or affected lung on the left. So you can see the lung goes into fibrosis, you can have empyematosis, you can have chronic emphysema, you can be located in all cancers in the body. Are we together, everyone? Okay, good. Let's go to the next slide. In the platelets, they've talked about liver cirrhosis. Of course, cannabinoid, alcohol, and products of cannabis like Colorado directly cause liver fibrosis. And you can see the healthy liver up. It goes down to fatty liver disease, getting to liver fibrosis, and then by the time liver cirrhosis is formed in Africa, it's more or less a death sentence. Of course, we know that liver transplant happens in developed countries like the United States of America, where people donate their organs before they die. Or in Nigeria or in Africa, you know, everybody donates nobody who donates their organ. Everybody dies with their organ. So people have been on the queue in the United States, some 5 years, 7 years, waiting for liver transplant. And that is the point of liver cirrhosis. Next slide, please. In the kidneys, especially painkillers, in the platelets, too, they made mention of drug misuse. When you use medications that are not prescribed by medical practitioners, then you are at the risk of destroying your liver by yourself. Some of us will take painkillers like Panadol, Septrin, what do they call it? Panadol and acetaminophen, pentazocine, and all of that without doctor's prescriptions. And our kidneys are at the risk or at the receiving end of this self-medication and prescription. Next slide. What's the effect on our academics? There's cognitive decline, a short-term memory loss, ability to recall, attention in class reduces, and then there's mental fog, which now leads to decline in grades. Of course, absenteeism, dropouts from school. You will see clients in the facility where you see someone has gone to 4 different universities without having a diploma. That is what substance abuse arises to. Of course, lots of carryovers that even the university system might have to eject some or rusticate some out of school because you have overstayed your welcome in the university system. Behavioral issues, exam malpractices, and then cultism and violence are all consequences of substance abuse. The next slide. Social consequences, I'll be finishing in the next 2 minutes. It breaks down family trust. You can imagine that this family that was once united, now blame games started. That is your son. Of course, in Africa, every good son belongs to the father. True or false? The bad child or the child that has a challenge is for the mother, and you can see the blame game. And then while parents start blaming each other, addiction flourishes again. And then social isolation, self-withdrawal, increased vulnerability to cultism and the likes, damage to future career prospects, harassment by security agencies because you always find yourself at the other side of the law. Okay, the mental health consequences. Of course, from anxiety to depression to full-blown psychosis. And you know the funniest thing? Teenagers, are we in the house? Hello? Science does not know what quantity of cannabis you will smoke that will make you have psychosis. Nobody knows that. There are people that have tried, in fact, in my practice, I've seen young people that tried cannabis for the first time and they ended up with permanent mental damage. First use, beautiful story of one of my clients, graduated with first class in law in a foreign university, and on their valedictory party day, she tried cannabis for the first time and she had a major blow to the brain. She's not been able to do anything in the last 15 years, despite the fact that she graduated with a first class in law. So, people have smoked cannabis for 10 years before the direct effect on their brain. Some have only used for 1 week and the brain gave way. Do we understand? Of course, I've discussed addiction cycles, sleep disorder, suicidal thoughts and suicidal ideations, and even attempting suicide. You can see the increase in our society now, not because of anything other than the fact that people now play with depressants and they don't want to be depressed. Of course, if you take depressants as psychoactive substance, like alcohol is a depressant, rohypnol is a depressant, benzodiazepines, diazepam, they are depressants, and then the person comes down with clinical depression. And then, of course, the whole spectrum of mental health condition. Next slide, please. What are the protective factors? Strong family ties and religious support. I tell people jokingly that some of us also escape these vices because we became attached to God very early in life. So even when you want to do something bad, maybe somebody has known you as the ustaz of your class or the pastor of your class, you won't be able to do those things. So strong religious support helps teenagers to be able to protect themselves from social vices. Of course, counseling units from secondary school up to university, peer mentorship and student engagement like what we are doing today. We expect you able to lead this session and be able to return back to your schools and serve as positive agents to fighting substance abuse. When one of your classmates is using, you are not loose guarding, or you are not casting the person by reporting to the direct authority. You are simply helping this person to protect his future. So, at the heart of Stellar Heart Foundation is for you guys to go back to your schools and serve as positive ambassadors. How to say no and stay strong. We need to learn to be assertive as we grow as teenagers. Being assertive is you saying no to any social vices. You don't owe anybody an explanation. Your future, your dream is clear to you, and any distraction, you should be able to say no to it. You need to leave real-time situations that are tempting. Leave that friends. The friend will not force you. You are in a high-risk environment, move away from the high-risk environment. You know that things that will help you to be assertive in growing up, you have to be able to say no to people, persons, that's places, people, and things. Places that your peers are going to club, going for parties, and no, I'm not going there. That is an high-risk environment for me. People, friends that you know that are users in your classes. Say, no, this person will not be my friend. The fourth point, have a ready excuse, such as, no, I can't smoke, it is alien to our family. I'm on medications, I cannot be smoking. Or even my family members take us for routine drug tests. Because this is one of the things that we are trying to advocate now, that drug testing should not be a matrix for punition or for discipline. Instead, drug testing should be part of the regular family checkup. You are not drug testing your kids because you are suspecting them. No, you are testing them because they live in a high-risk environment. An environment that a young child can eat cookies and does not know that the cookies has cannabis in it. An environment that you take your 6-month-old to the crèche and the crèche teachers serve them with codeine diet for 40 babies to be sleeping at the same time. So how do you know? You know by being watchful as parents and making drug testing, demystifying drug testing as part of the routine family check. And then you can overcome your peer pressure by reminding your friends that, hey, we do routine tests in my school, I cannot fail my drug test. Hence, I am not tasting this psychoactive substance. The next slide, please. Where to get help? I'm rounding up now. Where do I get help? Don't hide anything from your parents. Can you tell your friends, say, talk to your parents. Look at someone and say, talk to your parents. Now, some parents are not supportive, but still talk to them. We know that we have some parents that does not understand anything. True of us. And it's very painful that many kids are growing with parents that themselves, they are ignorant of many things happening in their environment. But even at that, talk to your parents, because your parents will know someone that they can also talk to that can be able to help you. Talk to your teachers. I know now that substance abuse or drug abuse is now incorporated into most school curriculum, even from primary school. So talk to your teachers. Your teachers know something about the pressure you're facing, and that will help you. Once you are able to discuss any peer pressure, the intensity of that pressure reduces by more than 50%. Do we understand? And then, of course, talk to healthcare professionals. You can reach Stella Heart Foundation. They can link you up. Next slide, please. The next slide is my references. You can see the references. Of course, as a way of concluding, your brain is your greatest asset. What makes anybody who they are, what made Professor Ebile to be here today is nothing other than his brain. If you remove his brain and put in another person's soul, that person will also be Professor Ebile. True of us. So, your brain is your greatest asset. Protect it. Tell your friend, protect it. Tell your friend, protect it. One decision can change your entire life. So, make positive decisions. Help is always available. You are never alone. And then, of course, your real friends will respect boundaries and respect your choices. I know that you have noted some questions. There will be time to answer those questions in the course of this program. Thank you very much. Put your hands together for yourself. Thank you.